Most disc bulges at L4-5 and L5-S1 don't require surgery. But what if the pain just won't go away? If you've been diagnosed with a lumbar disc herniation, stenosis, or sciatica, chances are you've been stretched, adjusted, or injected, but the pain keeps coming back. What most people don't realize is that non-surgical spinal decompression could be the missing link, but it's wildly misunderstood and often dismissed too soon. That's why in this video you'll get a clear breakdown of how spinal decompression really works. No fluff or jargon. The honest pros and cons, including what your doctor probably didn't tell you, and why we use a Back On Trac, a decompression system that's so gentle and effective, even patients with severe disc bulges tolerate it easily. I'll walk through exactly how Back On Trac decompression chairs work, who it's best for, and how one patient with an L5-S1 disc bulge went from painkillers to pain-free in just a few weeks. And at the end, I'll reveal one red flag sign that tells you decompression won't work for you, so you don't waste your time or your money. Hi, I'm Dr. Kevin Wafer, a chiropractor based in Houston, Texas. I help people overcome disc bulges, sciatica, and chronic spinal issues without surgery or risky medications, using specific chiropractic corrective care. This channel is for busy people dealing with pain who want real, practical strategies to relieve pain, restore mobility, and prevent future flare-ups. Subscribe now if you want expert tips, simple exercises, and proven strategies that help you move better, feel stronger, and stay pain-free. If you're dealing with a lumbar disc bulge, disc herniation, sciatica, or spinal stenosis, you already know this isn't just back pain. It's the kind of pain that shoots down your leg, keeps you up at night, and makes simple things like walking or bending feel impossible. And the worst part? You've likely done everything right. You've tried chiropractic adjustments, physical therapy, home exercises, maybe even massage therapy. When that didn't work, you went to your doctor who gave you cortisone shots, maybe an epidural injection or two. This may have helped a little, but the pain always comes back. If this sounds familiar and you've been through the same thing, leave a comment below. I want to hear your story. You're watching this because a part of you still believes there's another answer, and you're right. But you're at that scary crossroads. Surgery is on the table, and you're being told it might be your only option. But here's what no one told you. There's a conservative, non-surgical way to treat the disc directly. Not just mask the symptoms, not just stretch the muscles, but decompress the disc and relieve the pressure at the source. If no one has shown you how non-surgical decompression actually works, this could be the treatment you've been missing all along. So what is spinal decompression? And why haven't more doctors recommended it? Let's break it down in simple terms. When most people hear spinal decompression, they imagine being pulled apart, but that's not what this is. Non-surgical spinal decompression is a controlled, computer-guided therapy that gently stretches the spine to relieve pressure on the lumbar discs and nerves, especially at the L4-5, L5-S1 levels where most problems happen. Here's the simple explanation. When a disc bulges or herniates, it presses on nerves. This creates pain not just on your back, but down your legs, sometimes even into your feet. Spinal decompression works by slightly opening up the space between vertebrae, giving the disc room to retract and heal. Think of it like unpinching a garden hose. You don't need to replace the hose. You just need to remove the pressure so the flow returns to normal. It's completely non-invasive, no needles, and no surgery. The decompression table does all of the work by applying gentle traction and cycles, and this motion helps draw nutrients, oxygen, and fluids back into the disc to support healing. This isn't passive stretching or a basic inversion table. This is targeted relief for the exact disc that's causing your pain. But is it too good to be true? Let's break down the pros and cons, including what your doctor probably never mentioned. Let's be honest, no treatment is perfect. So here's what you need to know about spinal decompression without the hype. The pros. First, it's non-surgical. That means no incisions, no downtime, and none of the long-term risks that come with spine surgery. Second, it targets the root cause. It's not about masking symptoms. It's about reducing disc pressure and nerve compression directly. Third, it's gentle. Patients often say they feel relaxed during sessions. Sometimes they even fall asleep. For many people, especially those afraid of being twisted or adjusted, this can feel like the safest approach they've tried yet. Now the cons. It's not a one-and-done solution. Non-surgical spinal decompression works over a series of sessions. Depending on the severity of your condition, that could mean multiple weeks of treatment. It's also not for everyone. If you have severe osteoporosis, spinal instability, and certain post-surgical hardware, you may not qualify. And finally, most insurance plans don't cover it, which means you'll need to weigh the cost versus potential outcome. The real question is whether the potential for long-term relief is worth the investment of time and money for you. For many of my patients, it absolutely is. So why do you use the Back On Trac specifically? Let's show you how this specialized chair is different and why it changes the game for patients who couldn't tolerate other decompression systems. Not all decompression tables are created equal. We chose the Back On Trac system for one simple reason. It makes spinal decompression more effective and comfortable for our patients. Unlike traditional tables that use tight straps and rigid setups, Back On Trac uses a no harness design. That means no belts across your chest, no uncomfortable tugs, and no fear of being locked into a machine. It also features a seated entry system so patients with severe pain or mobility issues don't have to climb up awkwardly. They simply sit, lean back, and let the chair do the rest. Back On Trac also combines lumbar decompression with vibration therapy, which helps relax tight muscles during treatment and enhances the therapeutic effect. The system offers pre-programmed protocols that can be customized for your specific condition, whether you're dealing with a disc bulge, stenosis, or sciatica. Now let's talk about who this therapy is for, and more importantly, who it's not for. If you fall into the wrong category, decompression may not help, or could even make things worse. Spinal decompression sounds promising, but it's not a one-size-fits-all solution. Let's make it simple. If you've been diagnosed with an L4-5 or L5-S1 disc bulge, lumbar disc herniation, spinal stenosis, or sciatica, and your symptoms haven't responded to conservative care like physical therapy or chiropractic care, spinal decompression might be for you. It's also ideal for patients who want to avoid surgery and need a gently, non-invasive treatment that actually targets the root cause of the nerve pain. If your pain flares up when you sit, stand too long, or bend, and especially if it radiates down your leg, you're exactly the kind of person spinal decompression was built for. But if you've had spinal fusion with rods or plates, suffer from severe spinal instability, advanced osteoporosis, or neurologic symptoms like loss of bowel or bladder control, you may not qualify for decompression therapy. These are red flags that require a different kind of intervention. The good news? A proper evaluation can usually tell within minutes if you're a good candidate. But let's not move beyond that theory. In a moment, I'll share a real story of a patient who came in barely able to walk and how decompression changed everything for them. That patient's name is Michael. He came to our office with herniated discs in L4-5 and L5-S1, causing constant lower back pain, with numbness and tingling down his left leg and weakness in his left foot. He had been suffering from these symptoms for almost 6 months, and it was affecting everything. He couldn't walk without limping, and couldn't sit or stand for a prolonged period, making it hard for him to complete his job duties. He had already tried over-the-counter medications, steroid injections, and physical therapy, but nothing gave him any lasting relief. By the time he came to our office, he was already scheduled for surgery in just a few weeks. But what hit the hardest wasn't just the pain. It was the frustration of not being able to walk without pain, and the fear that he would never regain the strength in his leg again. When he first heard about spinal decompression, he was skeptical. But after we explained how the Back On Trac worked without twisting or surgery, they agreed to start our program. We created a customized plan starting with 12 decompression sessions over the next 4 weeks. Each session included spinal decompression combined with pelvic adjustments and electric muscle stimulation. By the end of the 4th week of treatment, he reported a 70% reduction in pain and even canceled his scheduled surgery. And after a couple of months of treatments, his leg pain was completely gone. He regained the strength in his left foot and was able to walk again without limping. And more importantly, he has his life back. He was walking without fear, sleeping through the night, and completely avoided surgery. That's the power of treating the root cause with non-surgical spinal decompression, not just the symptoms. However, there is one critical warning sign that tells us it might not work, and I'll show you exactly what it is next. As powerful as spinal decompression can be, there's one red flag that we always screen for, because if this shows up, decompression might not help and could even delay the care you really need. If you've experienced loss of bowel or bladder control, increasing numbness in the groin or saddle area, or progressive leg weakness, you may be dealing with a more serious condition called cauda equina syndrome. This is rare, but it's a true medical emergency that usually requires surgical intervention. And no, spinal decompression won't fix it. In fact, delaying surgery could make things worse. That's why I don't guess. Every patient is thoroughly evaluated before I begin any kind of treatment. Another contraindication, if you've had spinal fusion, surgery with rods or plates, decompression may not be effective in your case. These aren't common, but they're critical to catch early. The bottom line is this: the right patient gets real results. The wrong patient risks disappointment or worse. So what should you do next? Let me show you how you find out if you're a candidate for spinal decompression and what to expect if you move forward. So now you know what spinal decompression is, how it works, and what it's for, and what kind of results it can deliver. But the real question is how you know if it's right for you. The first step is a proper evaluation. In our office, I start with a detailed consultation and a thorough exam, including orthopedic tests, neurologic checks, and postural evaluation. I'll also review your MRI or other imaging if you have it, and I'll test specific movements to see how your body responds. From there, I can tell within the first visit whether you're a strong candidate for spinal decompression or if another treatment would be more effective in your case. There is no guessing, no wasted sessions, just a clear treatment plan based on your condition and your goals. If you're a good fit, I'll walk you through the treatment program step by step, including how many sessions you may need, how often, and what kind of results you can realistically expect. You also know what its costs and whether your condition is likely to respond based on past patients just like you. You don't need to stay stuck in pain. You don't have to settle for injections or jump into surgery without exploring other options. Don't give up. You owe it to yourself to explore spinal decompression before the pain gets worse, the disc injury progresses, and the surgery becomes your only option. If you're ready to see if spinal decompression could be the solution to your problem, reach out to us to schedule your initial evaluation. If you made it this far, you know something important. There's hope. You've just discovered a treatment most people don't even know exists. Non-surgical spinal decompression, especially a system like the Back On Trac, could be the missing link in your recovery journey. You don't have to keep living in pain. You don't have to jump right into surgery. In fact, a 2025 clinical case series reported up to 80% pain reduction in patients using spinal decompression. In addition to significant pain relief, patients also recover faster, reduce or eliminate the reliance on pain medication, and avoid the risks, costs, and long-term complications associated with surgery. If you found something new or hopeful in this video, share and like it. It tells us this content matters and helps others find us. Drop a comment below if that gives you hope. Let me know. I read every comment and would love to hear your story. Subscribe now if you want expert tips, simple exercises, and proven solutions for spine-related conditions like back pain, herniation, sciatica, and leg pain, designed to help you move better, feel stronger, and stay pain-free. And if you want to avoid exercises that could be making your lumbar disc bulge even worse, watch this next: 5 exercises that make lumbar disc bulges worse.